Hi, I'm Vanessa Lee, registered nurse, top aesthetic injector, and a trusted authority in the world of beauty and skincare.
I'm Nurse Janet, aesthetic nursing director at The Things We Do, and trainer and mentor to new and future injectors. Welcome to the podcast. Join us as we cover all the things we do for beauty, weird shit included.
This episode is sponsored by The Things We Do. Come visit our locations in downtown LA, Venice, Chino Hills, Beverly Hills, and coming soon in Oahu. You can also inquire about our appointments and get a feel of what we do through our IG and TikTok at thethingswedo.co, or simply stroll on into the beauty bar and pick up all of your skincare essentials. We want to hear from you. Please send us a DM on our IG at thethingswedo.co with your questions and comments, and we will be choosing a listener to shout out and have their questions answered on upcoming episodes. Okay, you guys, today we're going to do something really fun where we're talking about some of the funniest and craziest things that have happened with patients. We'll talk about some of the coolest tips, or I don't know if they're cool, crazy tips that they've given us too. So I guess let's go ahead and dive into it. Janet, what is the craziest thing that has happened in a patient room? Treatment room.
I don't know. Okay,
patient.
I don't know if mine is in a patient room, like something that happened, but it's something that a patient told me.
Okay.
So I had a patient that kept coming in to get Kenalog shots. So for those of you who don't know, when you have like these really cystic breakouts, you can come into the office and we can inject Kenalog into the breakout and it'll help the inflammation subside. So she came in and she came back in 2 days later for a new set of breakouts, and then she made another appointment, and I was like, okay, when she comes in, I need to start asking some questions because this is really interesting. I got a baseline, but clearly something's up. So when she came in again, I was like, I've asked you this, but really I want you to take a look at what are you using that's new in that area? And she just got really quiet. And I was like, you can tell me, you have all these breakouts, and then I feel like the ones that we treat, within a week, there's a completely new set. So then she told me
I have no idea what's going to happen right now.
She told me that every few days or so, her boyfriend is in construction, and when he comes over and they're intimate together, he doesn't wash his hands and he likes to grab her neck. So her breakouts.
Oh, the breakouts were on the neck.
Yes, on the neck area. Because I was like, what is she using?
And he doesn't. Here's the problem, though. Man's needs to wash his hands.
That's what I said. I said, you need to have a discussion with him.
Oh my God. In no universe would I ever be
a construction worker.
I don't even let my children touch my face without them washing their hands.
He's just so spontaneous. I can't stop him.
Wow.
And I said, well, this is a very expensive.
I know, right?
Also, but I was like, you also can't keep getting these injections.
Okay.
Like, you can't keep doing that. So when she said that, I was like, oh my gosh. And, you have to keep a very neutral face. She was laughing.
You like, is it worth it?
I know. I just told her, I said, I would have a talk with said boyfriend.
Oh my God.
So I was like.
Grabs my neck with his dirty hands.
Just grabs her neck.
I can see.
I'm not going to lie. I told her at that point, I was like, a little jealous, but go for it, honey.
There's no way. The way I would clock you in the chin so quickly, man, if you put your dirty hands on me.
This picture of this rugged construction worker coming home.
I love that you feed into that. Okay, great.
Those are my stories, yes.
And then what about craziest, like with the patients in your chair, you're doing the treatment, has anything weird happened?
Nothing comes to mind, and I know you have a few, so maybe when you talk,
I just
things will come into my head. I get
so
crazy
many weird things happen to me.
I get crazy stories. Like my patients tell me crazy relationship stories where I learn
you guys
so
are
much.
Talking. It's therapy.
Like, yes, it's like a whole therapy session, and the things that I find out, I'm just like, well, I'm gonna learn from this. I feel like you have some crazier stories.
As far as craziest thing in the room, earlier on in my career when I was still doing laser hair removal, this was probably this was very early on in my aesthetic career. I remember wanting to prove myself, and at this place that I worked at, nobody wanted to laser men, any of the providers. And I was like, yeah, I used to work in the ER. I've seen it all. It's just anatomy, whatever. All treat men. And my boss was like, are you sure? Because I'll support you if you don't want to. And I was like, no. Like, I'm open to it. It's fine. And then I realized that there was a reason. First of all, I should describe this place. It was a strange place that served a strange demographic is all I'm going to say, in the valley somewhere. Okay, so take that for what it is. I had a male patient come in and he wanted to do some like manscaping, and I was like, okay, fine. And you talk about what they want, all of that. At the time, I was pregnant and I was like very sensitive about like smells and like just everything, right? So anyways,
Where's this going?
I'm lasering this gentleman on his balls and the shaft of his penis. And I'm realizing that things are happening. Things are starting to get activated. And I'm like, okay, great. I'm done with that. I ask him to turn over because part of like the male full Brazilian is also the anus, his butthole. And so I hate talking about this. It makes me like, I'm going back to that procedure right now and I'm right there and I can see him. Like I see exactly his face, everything. Anyways, he turns over, I'm lasering him, and there's a smell and there's a movement. And and I want to die saying this because I think I buried this back in my soul, and now it's coming up that we decided to do a fun and crazy episode. He ended up ejaculating.
Oh my God.
And I ran out of the room.
Oh my God.
And I start crying because I'm just like sensitive overall, and I can't believe this has happened. I'm so embarrassed for some reason, and like, you know, I don't know what he was going through mentally or physically.
What did he say?
But all I know is the laser hair removal process, the machine we had at the time, was not one of these newer, comfortable machines. It was a painful machine.
Oh, so.
You know what I'm talking about.
Yes.
So something was setting this guy off. And I immediately run to like my boss and I'm like, hey, listen, this just happened. I can't finish the treatment. I'm so sorry. And I don't think I can treat men anymore. I don't want them. Like this is, it's a no for me. I don't even know what ended up happening to that patient because I was so mortified afterwards. Like I needed a moment to just collect myself, and like they ended up, I guess, like checking him out, and that was that. And nobody else was treating males. So I think that was it. It was a wrap. So that was probably the craziest thing with a patient for sure. And that was early on in my career. And I remember thinking, I need out of laser hair removal.
Yeah.
Like it's not going to be a part of my future. I want to do fully injectables and that's it. And that it's really, you know what, and God bless, because I've gotten laser hair removal and, you know, everyone's parts are different and stuff, but I definitely wasn't orgasming all over my provider, you know, so that's the craziest thing. What about, also, it always comes from men, like I've also had, you know, requests for like Botox in the scrotum and stuff like that. And that's definitely not something where I take offense to because it's a legit question, but also it's not my specialty. So I refer them to providers who I know do that stuff. So Botox balls.
You got to give me that referral list for people then.
Yeah, I'll
because
give it to
you know, when I was like dating people, you know how many guys are so crazy. They would ask, but I could tell like they weren't asking it to be offensive in any way.
Yeah.
Once they found out what I do for work, they were like, "Hey, look, I heard about this." And I was just like, "Oh, okay." And at first I'd be like,
guys just talking about this?
Yeah, and at first I'd be like, I think one time I got like really upset, like why would you even ask this, like, you know, on a date? And then he was just like, oh, you know, I honestly, like, I saw your Instagram. It looks like you really know what you're talking about. So if there's anyone I would trust to guide me on this, it's you. Oh. And then I was like, oh, they're just.
So he just didn't like.
They're just helpless, like
the wrinkles on his balls, which
wrinkles.
is like so normal. You need that.
But then
first of all, what ends up happening is they get so smooth, you lose the ability to contract that muscle, right? They get so smooth, and then it's dangerous. This is from the mouth of a dermatologist in New York who does this, who told me this.
Yeah,
it's dangerous because they're just hanging, and you can sit on them and squish them, and it's like a whole thing. Like you need that mobility, you know. Anyways,
I mean, I've gone to request for like dermal filler, you know, in the shaft. That's weird.
That which also I refer out.
Yeah, which I know people do, but I'm like, I wouldn't know.
Yeah, that's actually like you can do like 10 cc's in a penis shaft and really work on that girth. And again, that's not my specialty, nor will it ever be. And God bless to those who handle that. You know what I mean? It's just like not for me. Maybe I'm not mature enough. Maybe it's just like not.
I'm not that
my
progressive
thing,
yet. Like
I just like this is my strength right here.
Yeah.
Everything down there, I feel like really hand that off to the people who love to do that, and that's their bread and butter. And it's not us.
Not me. No. No, ma'am.
What about the craziest or most interesting skincare tip from a patient?
No, I don't have any for this one. This one I'm boring. No, I don't. Nothing comes to mind. Because I also like yours is Well, just say yours. Yours is so crazy.
Mine. So if you are newer and joining us, or if you haven't listened to our previous seasons, my first season, I think it might have been like the first or second episode, I
Yes.
talked about this, where a patient was discussing with me that she had like 5 children, something intense, like 4 or 5 children. She was in her like late 50s, and she just looked so wonderful. Like her skin was super smooth. She just looked radiant. She looked amazing. And I was like, have you ever had Botox? Have you ever had filler? And she was like, no, I've never done any of this stuff. She was in the room actually because she wasn't the patient. Her daughter was getting her lips done. Her daughter, who was an adult, by the way, was getting her lips done, but, you know, brought her mom along for some moral support. And she was like, oh yeah, I've never done any of this stuff. And I was like, clearly you have a secret to share with me.
Yeah.
You look amazing. What's your tip? And she was like, well, have you ever had a semen facial? And I was like, I'm sorry. And
what now?
And she was like, yeah, a semen facial. And I was like, not on purpose? Like, what are we, like, what are we even talking about right now? I couldn't even, like, I was like, what, tell me more. And she was like, well, you know, for years and years, I've had my husband just like once a week give me a batch of his semen, and I just do like put it on like a facial mask, and I leave it on for about 20 minutes, and then I wash it off, and it has kept my skin so tight and so smooth. And I was like, by the way, you guys, she's telling me this story in front of her adult daughter, who, by the way, is just shrinking into herself and is like, mom. She has numbing on her lips. She's like, mom, stop it. Mom, stop. But yeah, I couldn't even believe it. So then I end up talking to a skincare rep of this company that we bought skincare from, like medical grade skincare later on. And I was like, yeah, could you believe this? And he was like, actually, yes. And there was a company that tried bringing this to market, like semen, protein, growth factor, all of that with it. And there was just too many possible liabilities and, you know, all of that. So like, I mean, like, whose stuff are we working with?
Well,
Is the source
we've
good
seen
enough?
on TikTok, right? The period blood facial.
Yeah.
Have you seen that?
That's real. Like,
what about it is real?
Okay, so that's another thing that a patient told me about. So a patient told me that she microneedles and like stamps at home her own period blood. And truth be told, this woman is stunning, and her skin is stunning, without, you know, very many interventions from us and our team. So, you know, there's that too. Yeah, I guess we get a lot of crazy tips from patients.
Yeah, I've heard about the period blood one. That one just came to my mind. And then I remember a patient said, because she saw it on TikTok.
Because she saw it on TikTok.
She saw it on TikTok.
Oh, this was definitely before.
This was recent.
This was pre-TikTok when my patient told me about this. This was probably in the year 2018. She told me, yeah, that's something that I do once a month.
I wish I could. I don't want to.
Yeah. You wish you could, but you don't want to.
I just don't want to.
You want to be that girl, but
I just have access to the, you know, just draw my blood here. Let's just do my PRFM.
Yeah.
I was going to say PFR.
Yeah. Like how you're just telling our patients. Yeah. What about, how about some funny things that patients pronounce incorrectly or maybe say incorrectly? I have like a small list of things in my phone that just patients will say it, and like, sure, I'll like gently correct them. Sometimes I won't even, because I just think it's like so cute and I know what they're trying to say anyways.
Yeah.
But are there things that patients mispronounce?
PRFM, they say PFMR.
Yeah.
I think they're trying to say like ASMR.
Yeah.
And then they'll say it, and then I feel so I don't want to correct them, because
Yeah,
I know
you wouldn't, 'cause it's like, whatever. Yeah.
This one, I don't know if they might be correct on this one. A lot of patients, instead of saying, I think they'll say Dysport.
Okay.
They'll say Dysport.
But in other countries, they do say
it. Yeah. So that's why I was like, oh, maybe they heard it somewhere else.
Mm-hmm.
We have some providers that I'm always correcting, but then I'm like, why? Like, I don't even know why I do it, because I don't blame them for pronouncing words that way. But, you know, like Restylane Define, they'll say define. Define.
Oh, the accent.
Yes,
is
it's the
on
accent. Yeah. Refine.
Okay.
Define. And I'm just like, define.
You're not correcting them, are you? That's just like a lifestyle choice.
That I'm like, when I say it, I go, oh, okay, so you're going to use Restylane Define.
Yeah.
And then they look at me and go, oh, and I don't want to make them feel bad, but I'm also not going to say it how they're saying it, you know? So I think once I say it, they realize to like self-correct.
Yeah.
So people will say things like that, but I will never, I can't correct them.
Yeah.
I don't have the heart to.
Yeah, it's like,
What's
does
the
it really
point?
matter?
Yeah, does it really matter?
The refine and refine, like
Refine.
that to me is
Define.
like not that's just more of a okay, that's interesting, you know, but I'm not going to be like it makes it sound like when you explain it to
Yeah.
patients you don't know what you're talking about. I wouldn't at that point. But I have had a patient ask me to inject their labia, and then I was like, "Oh, that's not a service I provide actually." And they were like, "Are you sure? Because I'm pretty sure I've seen posts about it on your social media page." And I was like, "I guarantee you that there's never been a labia post ever on my page." And she was like, "Wait, am I pronouncing it correctly? Am I saying it right? It's this part right here." And she pointed to her laugh lines, her nasal labial folds. And I was like, "Oh, I thought you meant labia because you said labia. It's the nasal labial folds or just laugh lines or whatever." Yes,
Smile
you're right.
lines.
I definitely do treat those. And it was just something so, and we had a good laugh about it. It was so sweet. Patients often will talk to me instead of saying, they'll talk about their skincare routine, but they'll say my skincare regime. Like a government coup,
Yes.
you know what I mean? And I'm always like, okay, you know, like
It's
I
so
just go with it.
cute.
It's whatever. Like I really don't care.
Yeah.
But if it was like a provider who was saying that to patients, I would be like, hey, whoa,
Don't,
whoa,
calm
we've got to
down.
talk about this.
Yeah.
But the skincare regime, and I think we see that in comments a lot too. That's something that's common.
And then I think like with the Dysport, like I'll be like, okay, so today we're going to try Dysport then. And then they'll be like, oh my gosh, I'm so sorry. I thought it was pronounced Dysport. And I look at them and I'm like, oh, it's the
just way
same
we
thing.
say it, but
yeah,
some other
it's the same thing.
countries pronounce it a
Yeah.
different way. It's fine. A few funny things that I feel like happen in the office every now and then is how patients will process and get through the discomfort of a treatment.
Yeah.
For the most part, everyone just kind of seems unaffected and will just like sit there and get their Botox treatments or like,
Yeah.
lip filler and all of that. But I have had patients who will go into like a full tantric like moaning during the procedure.
It happens a lot, you guys.
A lot?
Yeah, it
For
happens.
you?
I remember, I think there was like one patient. I don't know if maybe she just came in so frequently or maybe I was just hyper aware, but like her face is coming to my mind right now. And I think around that period of time, I was like, oh, it's a normal thing because it was her plus like 2 or 3 others. And I was like, oh, people actually do this. It's a way of like, I guess maybe
Working
like,
through the pain. It's
working
a
through
coping
the pain. And
mechanism for them.
she told me it was the vibration that it causes in her mouth.
It distracts her from the discomfort.
Yes. Yeah. And I was like, well, we do have a vibrator tool you can. She didn't want
And
it.
it's silent. You
Yeah,
can just use
you
that.
can just,
And we don't have to make it seem like you and I are getting it on in this room right now.
Because
That's
in my head,
so
I was
crazy.
like, the walls in Venice are they're.
Oh, the walls in all the location. I mean, like, we're right next to each other.
Yeah.
If you talk loud enough, like, I can always hear when someone's having a good time. I can't make out the words of what's
But moaning,
being
you
talked
can
about.
make out moaning.
The moaning
You can make that out.
is like, oh my gosh,
Yeah.
what's happening? What's happening? And it's like 15 minutes, right? For like, and it's, it's something else. And I always laugh. I think it's so funny. Also, sometimes I'll have patients like during the treatment, they will have, it almost looks like they're seizing. Their eyes are rolling back to the back of their head.
Every
and
poke.
they're just like shaking a bit. And then I go, are you okay? And they go, oh yeah, I'm totally fine. And I'm like, okay. And then like I keep going and they do it again.
You're like, are
and
you
I'm
okay?
like, are you all right? And they're like, yeah, keep going. It's fine. And I'm like, oh, wow, this is just a different
They probably don't
way
even realize
to
they're doing
process
it.
the pain. Yeah,
Yeah.
they have no idea.
No idea. Absolutely.
I know I do something really funny when I'm injected. I can't stop talking. And 2, I try to control everything during the treatment.
God,
you know
yeah,
this
you
from
do.
injecting
Yes.
me. I'm a nightmare of a patient.
Yes.
And also I will go, like
Yeah.
I'm very vocal.
When the
if
needle's
something
like
is
coming at you,
uncomfortable.
you do that.
I go,
Like,
wait.
You
Let's talk about
wait.
this.
And I was like, oh my gosh. Me, I think I just talk a lot.
Oh, you
Because
do.
I even have a video of you injecting my jawline.
Okay.
And you're like, okay, Shannon, we need you to be quiet now.
Okay, I need you to stay
I
still.
need you to stay still. When Janae's doing my lips, because I don't like the feeling of numbing, so I don't even numb. And she's like, does that hurt? And I was like, no, it feels fine. She goes, okay, Janet, just like just I talk a lot.
I think it's so interesting all
nerve
the
thing, I
different
think.
ways that people deal with the discomfort and
Yeah.
all the things that we're exposed to in the rooms with patients. One time I did have someone request the most strangest thing because they were in discomfort. They asked me to hum. And then I'm humming Just Anything. And then she goes, actually, can you sing Mariah Carey songs?
Oh.
And I was like,
Yes,
is
I
this
can.
because I'm Filipino? Because you know I can, because she's our queen.
You're
And
like,
I
you
grew
know
up
I
singing
can.
her songs, but also, no, girlfriend. Like, I need to
That's a
focus
lot,
on my
yeah.
job right here. This is crazy.
I had
That's probably the
one-
craziest request, other than Sugarfina gummy bears while someone was in the waiting room.
They
do you,
wanted it?
Do you have any of the Dom Perignon Sugarfina gummy bears while I'm waiting?
No. We don't carry those on hand.
No, ma'am. Sorry, we're fresh out of those.
I had one patient where when she still comes into this day and she, like, I numb her, and it's every time we do her lips, she says, I just need you to talk and I can't stop talking. Like, I need
Oh,
I
you
need to
need to
talk.
be talking the
I need
whole
to be
time.
talking the whole time and I cannot stop.
Oh,
and
yeah,
I cannot
some
ask her
patients will ask
questions.
me to tell them
so
stories.
so she'll literally tell me, okay, just start filling me in on everything about your life and don't stop. Okay, don't stop talking. And I'm like, okay. So then I literally just sit
Tell her
there.
everything.
It's really hard to do, you know? So like I'll literally start with like what my kids and I did that past weekend and like all
Yeah.
this stuff. And then like you can't help but like open up about things. And I'm just like, okay, there's gotta be some point to stop. But anytime I stop, she'll be like, keep going. And she's for some reason has to like hyper focus on my story. But also like it's not really that interesting.
This is so fun.
Yeah, she has me do that every single time. It's interesting to say the least.
Janet and I didn't share these stories beforehand, except for the Jizz story that,
Yeah.
like obviously was from the first season. It's because I wanted to really be like, a real reaction.
Yep.
Like but it sounds like for the most part, I get some really strange stuff happening and your patients are like really normal and just want you to talk to them.
Yeah, my patients just like want a therapy session. Like I've learned.
See, I won't.
No, they just want to. They want to tell me everything they're going through, all the problems, all the relationship, familial issues, and then like I'm like.
Oh, they're telling you.
They're telling. Yeah, they're
Okay.
telling me. So then.
But you're not giving them advice.
No, because I just tell them like I just kind of encourage whatever they already say they're doing.
Yeah.
And then are like, oh my gosh, that must be so hard, But they just want to like sit there and like chat about it, like
Yeah.
And then sometimes they're quiet. But I think that's probably why I go home and I'm just my social battery's
Yeah.
1%.
When I said I can't, I thought that you meant like you're talking to patients about personal things as well. Like I don't love patients to know about my personal life. And when they're telling me all these things, I love it.
I love
I'm
it.
like, yeah, I
People lead
I'm
such
here for
interesting
you.
lives and I love it because sometimes when I think my life is just a little bit dramatic, I'm just like, oh no.
Oh, and these are not like the women leading the most interesting lives have the most ordinary professions out there that
Oh,
you
yeah.
think are not doing very exciting and crazy things. They are doing the exciting and crazy things.
Yeah, I love it. So, but
All
I
right.
also
Well,
get tired.
this was really fun. If you are a provider with a hilarious or crazy story, or if you are a patient that experienced something really fun, we'd love to hear from you. Please send us your story to our DMs. You can also email the podcast. Is it podcast at thethingswedo.co? Mm-hmm. Okay, great. Podcast. No. Okay. Because I know I say that kind of
It's
funny.
podcast.
Podcast.
Podcast
At thethingswedo.co. But thanks for hanging out with us.